We will get underway. We're running already 5 minutes late, so we will get underway. Welcome to Health Consumers Queensland's first annual forum. I'd like to thank Lachlan Hawkins and Renee Edson from Stairwell Project for entertaining us as we entered the auditorium today, and for the work that your project does to contribute to the healing process and well-being of consumers by bringing music and art to the public spaces and wards of the Royal Brisbane Women's Hospital. This research-based project is suitable to be expanded to other hospitals, so if you're interested, please see Lachlan during the morning tea break if you wish to know more about that. My name is Mark Tucker-Evans, and it's my privilege to chair Health Consumers Queensland. I'd like to pay my respects to the Aboriginal and Torres Strait Islander custodians who have cared for this country and their elders who continue to hold the knowledge of their rich and diverse cultures and acknowledge that we must work together to achieve equality in health status and life expectancy between Aboriginal and Torres Strait Islander people and non-Indigenous Australians. Before we get underway, I'm told I need to do some housekeeping. That'll be a first. In the event of fire or other emergency, trained emergency staff will direct all attendees to the nearest safe exit and to the assembly point, which is the main arena. Locations of toilets are out the door and to the right. If you need help, our staff, Health Consumers who are wearing Health Consumer Queensland badges, and the Advisory Forum Advisory Committee members all have green dots on their name badge, but I might actually get our team to actually stand up just so that you can recognise them. So all those wearing green dots. That's called a standing ovation in reverse. We are filming all sessions in the main hall, and we're also doing audio recording of the 3 meeting rooms, and we'll also be taking photographs. If you don't want your photograph taken, if you're here incognito or something, could you just let our staff know at the registration desk, and they'll give you a red badge, and then our photographers will try to avoid you. We also want to encourage widespread sharing of messages and learnings from today. So please follow us on Twitter, like us on Facebook, and post using the hashtag HCQAF16. The theme of today's forum is disruption in health to drive better health outcomes, the role of the consumer movement. Many of you have been with Health Consumers Queensland on our journey to support the health consumer movement in Queensland since 2008, when we were established as a Ministerial Advisory Committee. Since 2013, we've been a non-government organisation, and since the middle of last year, we've been funded by the Queensland Government. Nevertheless, we recognise that our work builds on the work of the many consumer advocates who've gone before us and continue to inform the health system by positively disrupting the system. Today is our chance for Health Consumers Queensland to share with you how we've evolved and the work that we are now doing to support meaningful consumer co-design of public and private health services in Queensland. We are pleased to showcase our best practice examples across the state, and we're grateful to all of those who will be sharing your experiences. Our thanks go to you and our staff, our board, our members of the Forum Advisory Committee, and all who've contributed to shaping today's exciting program. For the attendee list of 270 people, you can see we have a mixture of consumers, carers, parents, Queensland Health staff, consumer engagement officers, staff from many areas within the department. I'd like to acknowledge the Director General, Michael Walsh, a number of Deputy Director Generals. We also have clinicians in the room. We have staff and volunteers from consumer organisations, and also we'd like to thank thank the consumer organisations who've brought along displays and will talk with you in the breaks. So I would encourage you very much to take advantage of the various consumer and community organisations whose stands are around the edges. We also have been joined by staff from the primary health networks and private facilities and day hospitals. We also have representatives from our equivalent organisations that exist in other states and territories across Australia. We have representatives here from New South Wales, Victoria, the ACT, South Australia, WA, and we're also joined by a member of the board of Consumers Health Forum, the National Health Consumers Organisation. To get the day underway, I'd like to introduce Auntie Carol Curry, a South East Queensland elder. Thank you.
Bobo Bujuri, Bulu Bulu Walu, Jilawala Nirama means good morning to many, and I hope you are all well. Firstly, I'd like to acknowledge our past elders as they handed down the stories and the knowledge, and show respect to our present elders because they also hold the knowledge and the wisdom and the stories to share. And the Yulang Nahabala tribe, my skin, it belongs to two tribes. We have the Jaguar. My grandfather born 1841 on Jaguar country. His father before him. Our old people, they walked the land. So he travelled, my grandfather, from Laidley to Desert. That's Malanjali country. Married his wife, which was the niece to King Bungary. So I'm connected to Malanjali. They travelled again right over Tambourine, crossed the Tweed River, where my father was born, 1910. I was brought up and raised on Fingal, Poonabah country. So I always thought I was a Poonabah girl, but Aboriginal culture, we always must go back right to the beginning to find who we are and who we belong to. So I'm really connected to three tribes on southeast Queensland and the three totems. So we have Poonabah, the porcupine, Desert, the land eagle, and then you have the jaguar, the brown snake. On my mother's side, beautiful Fraser Island. We've changed that name 2 years ago to Gari, traditional owner from my grandmother's side. She was stolen at 16, taken down to the coast. From there, I've lost the gap of the story, but she ended up on Fingal, where my mother was born at 1918. There she met my father, and I'm one of 11. So you got me today out of the 11. I speak the Yoruba language. There is about 200 dialects we're trying to save, language and dialects. If we don't understand the other tribe talking, we'll just say, "G'day mate, how you going?" That settles it all. It is always our custom and culture to acknowledge and show our respect to the Turrbal people and the Jaguar, who lived and took care of this part of Mother Earth for many, many thousands of years. Aboriginal culture is the oldest living culture in the world, and our people, we give praise to our Creator, who placed our ancestors in this beautiful land, which was named Australia. gave them their culture. That culture has been taught, handed down from generation to generation for over 60,000 years in our spiritual ceremonies, our art, music, and Dreamtime stories. There's a little story I tell you about grassroots people, how they're trying to close the gap. My oldest son, he started up a Murray Carnival. It's still going. In that carnival, all players had to be checked. They couldn't play football unless the women and the men and the children had to have a complete health check. Some were found with diabetes, weak hearts, and they wouldn't have known they had these. The under-16 team, they were encouraged to go to school, finish school. If they took so much time off school, they were out of the game. They could not play. So that encouraged the education for the Aboriginal people, and the Murray Carnival helped men and women to look after their health. So we can help, as well as use, help our people to close the gap. So that's one of the little stories we do at grassroots levels. So thank you for listening to me. So Ning Yana Bra, I'll go now, thank you.